Respiratory System I. Overview of the respiratory system. 1. Key concept. The primary function of the respiratory system is gas exchange, taking in oxygen, O2, and releasing carbon dioxide, CO2. 2. Simplified explanation. Think of the respiratory system as the body's air pump, bringing in fresh air for oxygen and removing waste air, CO2. 3. Mnemonic, pairs. For the key functions. Providing oxygen, O2, allowing gas exchange, inhaling and exhaling, removing carbon dioxide, CO2. Speech, vocal cords. 4. Key components. Airways, passages that conduct air to and from the lungs. Upper airways, nose, nasal cavity, pharynx, throat, and larynx, voice box. Lower airways, trachea, windpipe, bronchi, bronchioles. Lungs, the main organs of respiration, containing the air sacs where gas exchange occurs. Alveoli, microscopic air sacs where O2 enters the blood and CO2 leaves it. Pleura, membranes that surround the lungs, visceral pleura, and line the chest cavity, parietal pleura. Respiratory muscles, muscles that aid in breathing. Diaphragm, the primary muscle of inspiration. Intercostal muscles, muscles between the ribs that help move the rib cage during breathing. Key processes of respiration. 1. Mnemonic, PEG, for the processes of respiration, pulmonary ventilation, breathing, movement of air in and out of the lungs. Inspiration, inhalation. Actively bringing air into the lungs via contraction of the diaphragm and intercostal muscles, which increases the size of the chest cavity. Expiration, exhalation, relaxing the diaphragm and intercostal muscles, which decreases the size of the chest cavity, and air flows out of the lungs. External respiration, gas exchange in the lungs, exchange of O2 and CO2 between the alveoli and the blood. Gas transport, transport of O2 in the blood from lungs to the tissues, and CO2 from tissues to the lungs. Internal respiration, exchange of O2 and CO2 between the blood and tissue cells. 2. Key concepts. Partial pressures, the pressure exerted by individual gases in a mixture. O2 moves from high to low partial pressures, the same with CO2. Diffusion, movement of gases, O2 and CO2, across the alveolar and capillary membranes. Hemoglobin, the protein in red blood cells that binds to O2. Ventilation, the process of moving air in and out of the lungs. 3. Regulation of respiration. 1 key idea. Breathing is controlled by the brainstem, influenced by chemoreceptors and lung receptors. 2. Mnemonic, CRAP, for regulation of respiration, chemoreceptors, detect changes in blood levels of O2, CO2, and pH. Respiratory control centers, located in the medulla and pons of the brainstem. Automatic control. Brainstem controls the rate and depth of breathing automatically. Pulmonary receptors in lungs, monitor lung stretch and irritation. 3. Key points, medulla oblongata, the primary respiratory control center in the brainstem. Pons, modulates respiratory rhythm, fine-tunes breathing. Central chemoreceptors, located in the medulla, sensitive to CO2 and pH levels in the CSF. Peripheral chemoreceptors, located in the carotid arteries and aorta, sensitive to O2, CO2, and pH levels in blood. Lung receptors, monitor lung stretch, irritation, and other factors. IV. Common respiratory disorders. 1. Mnemonic, AABC-PIR, for respiratory disorders. Asthma, chronic inflammatory condition that leads to bronchoconstriction and mucus secretion, resulting in airway obstruction. Acute bronchitis, inflammation of the bronchial tubes, usually from infection. Bronchiolitis, inflammation of the bronchioles, often in young children, usually caused by RSV. COPD, chronic obstructive pulmonary disease, umbrella term that includes chronic bronchitis and emphysema. Pneumonia, infection of the lungs, causing inflammation and fluid accumulation in the alveoli. Emphysema, a type of COPD where the alveoli are damaged, leading to decreased gas exchange. Restrictive lung diseases, for example, pulmonary fibrosis, reduces lung volume and impairs expansion. 2. Key features of each disorder. Asthma, reversible airway obstruction, wheezing, shortness of breath, coughing, and chest tightness due to airway inflammation. Acute bronchitis, cough, often with mucus, chest discomfort, and mild fever, usually self-limiting. Bronchiolitis, wheezing, difficulty breathing, and often in young children, usually caused by RSV. COPD, chronic airflow limitation, persistent cough with sputum production, chronic bronchitis, and/or shortness of breath due to damaged alveoli, emphysema. Pneumonia, fever, cough may produce sputum, shortness of breath, chest pain, and signs of lung consolidation on X-ray. Restrictive lung diseases, decreased lung capacity, dyspnea, shortness of breath, and dry cough. Diagnostic tests. 1. Mnemonic SPAL, spirometry, measures lung volumes and flow rates. Pulmonary function tests, PFTs, to assess lung volumes, flow rates, and diffusion. Arterial blood gases, ABGs, measure O2, CO2, and pH levels in arterial blood. Lung imaging, chest X-ray, Connecticut scan. Visualizes lung structure and abnormalities. Simplified explanation. 1. Air in and out. Breathing, pulmonary ventilation, moves air in and out of the lungs. 2. Gas exchange. Oxygen and carbon dioxide are exchanged in the alveoli of the lungs, external respiration. 3. Transport and exchange. O2 is transported to the body's cells while CO2 is removed. 4. Automatic control. The brainstem regulates the rate and depth of breathing automatically. 5. Disorders. Various conditions can affect the respiratory system, such as asthma, COPD, pneumonia, and more. Professor Hammer's advice for learning the respiratory system. 1. Understand gas exchange. The primary function is oxygen intake and carbon dioxide removal. 2. Know the key structures. Airways, lungs, pleura, and respiratory muscles are the important components. 3. Understand the mechanics. Inspiration and expiration involve muscle contractions and relaxations. 4. Recognize regulation. The brainstem, chemoreceptors, and lung receptors control breathing. 5. Understand the pathophysiology. Know how different conditions impact breathing and the respiratory system. In summary, the respiratory system is critical for gas exchange, bringing in oxygen and releasing carbon dioxide. It involves a complex network of airways, lungs, muscles, and regulatory mechanisms. Many conditions can impact this vital system, causing a wide variety of symptoms.